I was just saying, it's the labor of love for me, and not just for these two of my boys. They're twins. They're 4.5 years old. And that's Rohan, the bigger one, and that's Vikram, curtsy, steroids. So, but not just for them. It's for all the parents who are in the room, for Sohela, for Georgia, for Claire, for Ezra, for Regan, and all the kids back on our Facebook group who are not being represented here. And the first question is, why are we doing this? I thought this was me. I thought our case was really, really tough. And then I discovered about 2 years ago the Facebook group, which Leah runs. And I realized it was not just us. There's a lot of heartache, sadness, devastation there. I've seen enough for a lifetime. And I know that the dominant thinking is that biologics have helped a lot, and it was much worse, and it probably is. I do not have the history in this disease. But what I know, in today's world, there is still a lot of devastation that goes on. Families are destroyed because of this. And when I started understanding this, that's when we decided that we have to try to do what we can do on ourselves. So that's really what the motivation is to do this, is to help in any way that we can. So when we realize that this is what you would like to do, how do you go about doing this? As a patient foundation, how can you help the research? And we've thought a lot about that, as to what we can do to help, what kind of things that the patients on our side can do, and a foundation like ours, which can operate in between, can do. And I think a lot of it was articulated really, really well by Dr. Hoffman yesterday, and he spoke more on the research side, but you could get glimpses from his story that there was a very active, engaged parent community there. And I wish I could bring up his slides, and I spent a lot of time reading them last night. What really struck me was the fact that he talked about how 15 years ago there were 0 clinical trials, and now there are 60. And how the attitude has changed. And there was one slide where he talked about how people developed this can-do attitude and stopped being complacent. That's the attitude shift that we can happen, that instead of believing that what we have is good enough, if we aim for more and more children to be controlled and to be able to live lives that are full, complete lives. So I think that's the kind of mind shift that I'm thinking about, that it seems like at some point the DMD group had. I think what can we do? This is something we spent a lot of time thinking about. I think partly it is creating a more connected ecosystem in people just knowing each other, people who you can email, who you can talk to, and I think that by itself has tremendous value. And by organizing events like this, by creating digital connections, we can help with that. I think another thing that we bring to the table, and I think there's a lot of organizations in the field, and we like to work with everyone, but I think a single-minded focus on these group of diseases, which are complex, which are harsh, which are kind of unique. And SJIA kind of operates in this interesting point where it's supposed to be part of the JIAs, but it's not really. We all know that. Then it's very similar to Still's disease, and you could argue that's the adult version, but it has a completely different name, completely different worlds. MAS is a part of it, but there are other types of diseases which are mostly MAS on a genetic basis. So it operates in this very interesting space where it is really unique and different, and it needs that single-minded focus. And that's what we hope to do by being just focused on this. And I think working with everyone, I think one of the things that I think, especially personally, I feel strongly about is that I identify with a lot of you in this room. I was going to be a researcher and going into academia before I decided to become an entrepreneur. So I've done the research and the postdoc, et cetera, and I know at least the researcher aspect. I've worked in a clinic with Alzheimer's and Parkinson's patients for my PhD thesis for many years. So I'm not a doctor, but I identify with it. I've worked closely with them. I identify with the pharma companies because I've run a company and the small company, and I truly do identify with that struggle that, that how are we going to make it? And I also worked in a bigger company when we got acquired, so I understand that too. When you're sitting at the table and you have all these other people who also want the resources of the company, and you're saying that, no, I want to develop a drug for SJIA. So identify with that. I do not understand and identify with the regulators at all, but I hope that a few conversations with the folks here will help me understand that better. And of course, patient. I am the mother of a child, and at this point, that's my primary identity in this world. The next slide. So Dr. Hoffman laid out what kind of things that researchers can do, and I have been thinking about what kind of things patients can do. Next slide. Okay. No, go back. Yeah. So one thing that I'm not being able to show you, but if you go to our site, you'll see is that we've created a parents advisory board. It's just a few of the parents you see here and one or two more to begin with. But what it means is that you, as a researcher, as a pharma company, as anyone interested in this disease, if you have a question about a parent or you want to reach parents and patients, you have a place to go. And when we get that in some kind of question and query, we'll just discuss it and decide who's going to respond to it. And it's worth pointing out that I'm standing here alone, but behind, I'm not alone. There's a lot of parents who are part of this group. There's 500 of us in that group, and we are all ready to help. And Leah runs that group, and we are all here to do what we can. So that's the first thing. A simple mailing list, announcement-only mailing list, which is for you to send out a quick announcement, low traffic, moderated, or for patients to tell you something that we've done. We just did a parent survey about a week and a half ago, and I was hoping to actually show you the map of the patients all across the world, et cetera. We got 150 responses in a week, and we can do that. We really can do that. And this is just the tip of the iceberg. There's a lot more patients, and we need to slowly engage them and bring them onto the community. An engaged patient community can do a lot, and we actually have that. When I started to do this, I thought that I would have to build this, and then I discovered that no, we actually have that with SJIA. So my question to you is, what else can we do? What can we do to help this, to help bring medications to the kids who are not, for whom the current drugs are not working faster? Please tell us during this conference, tell me later, but we are all here ready and willing to help this process along. So with that, I think we'll go on to the patients panel and hear a little bit from the other parents too. Thank you.